The procedure that we're doing today is called ear hematoma repair. If you guys know, whenever a boxer goes into the ring and gets punched in the ear can get full of blood. That's because you have cartilage, you have skin, and there's a lot of vessels in between that cartilage. And then when anytime you have a traumatic event like fighting with other cats, other dogs, or even shaking their head a lot, flapping the ear, because it has an ear infection, is really itchy, so they flap their ears around. Whenever that happens, or any traumatic event, then those capillaries can basically, rupture, and that fills up the ear with blood. The chances of aspiration. Fat and floppy. And we'll suture surrounding it, and that's it. So we are doing induction on this cat. We just placed propofol, which is an induction medication to go under general anesthesia. Now we're going to intubate. Whenever we intubate, it's a two-person job. One person holds the mouth open and sometimes holds the tongue, depends on who's intubating. And then this is the tube that we go in there. And I find the arytenoids, which are the opening to the trachea. I really can't see anything. I don't know how to use that.
Was very happy that a person.
Okay, once intubated, now we tie the tube to the patient so that the tube cannot slip out. And then we also inflate. Every tube has a cuff, which will inflate inside the trachea and will also hold the tube in place. We have to be really careful when we inflate them. We cannot overinflate them, or we cannot underinflate them. If you overinflate, you can cause the circulation of the trachea to be, cut, and then that can cause necrosis of the trachea. If you underinflate and the patient by some chance ate something this morning, drank a little bit of water, and will have some vomiting or regurgitation, then you will have space and it will go into the trachea to the lungs, and that's why we intubate, so that we can decrease the chances of aspiration, which can cause pneumonia. The reason why prior to surgery we clip and clean the area is to decrease the chances of surgical site infection. That is, any infection that can come in due to bacteria, hairs, anything like that. That's why it's really important prior to surgery to clean it, clip it, remove all the hairs that are surrounding it. We do a pre-scrub and then an after scrub inside surgery suite. You see, this is the hematoma. That is basically hemorrhage or blood inside in between the cartilage and the skin. It's a pretty small one. Sometimes you can see the whole ear. Therefore, we'll just make a hole there and we'll suture surrounding it, and that's it. Pretty simple. There is a couple of things that we can do with ear hematomas. One of them is opening and draining it out without doing anything else. The problem with that is whenever you have dead space in between the cartilage and the skin, that dead space will fill back up with blood. Therefore, that's one of the procedures that we don't follow. Our procedure is going into general anesthesia, going into surgery, and opening a hole inside the ear. So you have the ear, you have the pinna, basically you have the inner part, the outer part. We open in the inner part, we make a hole, and then we suture all the skin and the cartilage around it so that it doesn't inflate again. And then we put a bandage for a couple of days, and then we let it heal, and in 14 days from today everything should heal properly. We'll remove those sutures and the ear will look beautiful. Fat and floppy.